an extreme agenda reflected in this one big, ugly bill. President Truman said to this Congress in a statement recommending a comprehensive health program, millions of our citizens do not now have a full measure of opportunity to achieve and enjoy good health. Millions do not now have protection or security against the economic effects of sickness. The time has arrived for action to help them obtain that opportunity and that protection. Truman goes on to say, President Truman goes on to say, our new Economic Bill of Rights should mean health security for all, regardless of residence, station, or race, everywhere in the United States of America. He says, regardless of residence, station, or race, that's presidential leadership. That brings people together, doesn't seek to divide us, which is what unfortunately is happening in the United States of America right now. President Truman goes on to say to Congress, we should resolve now that the health of this nation is a national concern, that financial barriers in the way of attaining health shall be removed, that the health of all its citizens deserves the help of all the nation. Truman goes on to articulate the challenges that exist in America as it relates to illnesses. He articulates several of them, talks about the deficiencies in health care that existed across America, and the fact that in the aftermath of World War II, it was clear that so many people without coverage were medically infirm. And he made clear that's unacceptable in the United States of America. He articulated a forward-looking vision for universal health care, aspirational vision, a vision designed to lift the American people up, not rip health care away from them, which is what this one big, ugly bill will do, ripping health care away for more than 17 million Americans. That's shameful. It disgusts me that we're on the floor of the House of Representatives right now having to push back so aggressively against an all-out assault on the health care of the American people when we should be trying to lift them up in a manner consistent, Mr. Speaker, with what President Truman once charged this Congress with doing. And of course, he wasn't the only one. We're thankful for other leaders who worked with this Congress in prior years to actually advance the health, safety, and well-being of the American people. President Lyndon Baines Johnson, in connection with the Great Society, inspired in part by his own experiences growing up in the hill country of Texas, seeing rural poverty and the devastating impacts of it. Something that he was inspired to address, as opposed to this one big, ugly Republican bill that will result in rural hospitals closing in the United States of America. That's not the type of leadership that this country needs, that rural America needs. Thankful that we have examples of the type of leadership that hopefully, Mr. Speaker, we can aspire to achieving in this country. President Lyndon Baines Johnson, in connection with the signing of Medicare and Medicaid, spoke to the American people. He said, because the need for this action is plain, and it is so clear indeed that we marvel not simply at the passage of this bill, but what we marvel at is that it took so many years to pass it. And I am so glad that Amy Forand is here to see it finally passed and signed, one of the first authors. There are more than 18 million Americans over the age of 65. Most of them have low incomes. Most of them are threatened by illness and medical expenses that they cannot afford. And through this new law, Mr. President, every citizen will be able, in his productive years, when he is earning, to insure himself against the ravages of illness in his old age. President Johnson was referring to President Harry Truman, who was there at the signing ceremony, having recognized President Truman's vision. He says, and through this new law, Mr. President, every citizen will be able, in his productive years, when he is earning, to insure himself against the ravages of illness in his old age. That was the beauty of Medicare. You pay into it, it's an earned benefit. And you can reap the benefits in your golden years. President Johnson went on to say, this insurance will help pay for care in hospitals, in skilled nursing homes, or in the home. It's ironic. That's what presidential leadership looks like. LBJ says this insurance will help pay for care in hospitals, in skilled nursing homes, or in the home. And yet, Mr. Speaker, we're here 60 years later, and Republicans are trying to jam a budget down the throats of the American people that will close hospitals, close nursing homes, and detonate the ability of millions of people to access home care. That's shameful. It's not the type of leadership that this country needs right now, but that's what we're getting. Chaos, cruelty, and corruption. President Johnson went on to talk about Medicaid, which is the subject of an all-out assault now by this reckless, Republican budget, the GOP tax scam, this one big ugly bill. So I want to make sure that the record reflects